No, keep holding up your sterile hand. Now, don't touch the bag. He's slowly going to, now, no, whoa, you're not sterile, so hold down here. Here, you hold here. And then slowly grab here. Don't touch the blue bag. There you go. Now you're gonna take it, get a good grip in your hand. Okay, go over to your, you can let go. Go over to your lubrication. You wanna keep that on the sterile field. Okay? And so let go. And really, you're fine. That stays. Really good. Very good. More lubrication, the better. Think about where this has to go, especially with our male clients. So be very generous when you're lubricating the end of the Foley catheter. Okay? Good. Now you're going to come back. Don't let that touch anything. You're going to take, and on the count of 3, you're going to let your
inside? No. Okay. So our kids do. So right here,
더 챙겨주는 거죠?
이렇게 챙겨서 이렇게 먹고 있죠. What we're gonna do, we're gonna pick this up because these are our gloves, right? And then we're gonna bring them over here, okay? So you're going to put on your sterile gloves. Everything else in here is sterile, so you don't want to touch anything yet. Just that. So nope, right? Because you're touching here. So when you're doing sterile gloves, you're gonna pick it up here by the cuff. And then, yep. Now you're gonna cuff it. Yep. So then that protects. Very good. And then you get rid of that. That's okay. You can touch it because yep. There you go. Now you're sterile. This right here, I'm just gonna touch. So, as a
sterile, because he donned sterile gloves. So now you're going to prepare. So this you're going to take out and you're going to open it up, and then you're going to, with your left hand, place it over the patient. So go ahead, pick it up. You could use both hands because you're sterile both hands.
I would just leave it right there.
Pick it up. Yep, don't let it touch anything. Now with your left hand, you're going to place it. Yep, because that's your non-sterile. Very good. You're going to place, this is how a female just gets the paper under her, where a male, obviously.
You're going to take your swabs and you're going to
So your right hand, pick up. Okay, good.
swipe in the middle and then toss, right? And then you're going to take your
What I'm going to do is I'm going to put his head down, because that does help. When they're go ahead and insert it, keep going. 10 cc balloon. Okay, you're done. And now drop down, and then that's it. Done. Now you're no longer sterile, so then you would.
Place a fenestrated
Auscultate the client's lung sounds. Apply a pulse oximeter on the client's hand. Apply clean gloves. Place a towel or waterproof drape across the client's chest to protect their clothing. Turn on the suction device. Adjust the regulator by occluding the connecting tubing to regulate the suction pressure to the appropriate setting, usually 100 to 150 millimeters of mercury for an adult client. Slide the end of...
So you're with a child or an infant, and there's two of you doing CPR. What is that ratio? How many compressions to how many breaths?
15.
Very good. You guys are better than our students. You guys are great. Okay.
Incident during embryonic development. The malalignment of the upper part of the ventricular septum, known as the conal septum, with the rest of it. As the conal septum moves rightward and anteriorly, it creates an opening in the septum, blocks the right ventricular outflow tract, and pulls the aorta over the ventricular septum. Finally, because the output to the lungs is obstructed, the right ventricle develops thicker muscle to push harder, resulting in right ventricular hypertrophy. The cause of TOF remains largely unknown, but several genetic disorders and prenatal factors are thought to be associated with increased risks of this condition. Connected ventricles in TOF allow blood to flow from one side to the other. The direction of this flow, however, depends on the degree of pulmonary tract obstruction. When the obstruction is minimal, the flow is left to right, because the left ventricle
of material prosperity 100 years later. The Negro is still languished in the
Flip. 1, 2, 3, 4, 5. Flip. 1, 2, 3, 4, 5. That I do if I have a baby. I have to have the
And Jesus can't save you like Stokes when the church came in with school.